articulate ligaments, and the filum terminale. The epidural space between the dura and vertebral wall contains fat and the internal vertebral venous plexus and is commonly accessed for anesthesia. Hematomas may form here after trauma. The subdural space is a potential space where venous tears can cause subdural hematomas. The subarachnoid space contains CSF and is used for lumbar puncture, pressure monitoring, and intrathecal drug delivery. The lumbar cistern, located from L2 to S2, is a subarachnoid space containing CSF and the cauda equina nerve roots. It is used for diagnostic lumbar puncture, intrathecal injections, and nearby epidural anesthesia. Punctures are typically performed at the L3, L4, or L4, L5 level, guided by the iliac crest line. The anterior spinal artery, arising from vertebral arteries, supplies the anterior two-thirds of cord, including motor tracts and anterior horns. Paired posterior spinal arteries supply the posterior tactile sensation, proprioception, autonomic functions, and motor control. There are 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Each nerve of meninges, with the spinal cord usually in place. Myelomeningocele is the most severe, with meninges and spinal cord or roots protruding, often associated with hydrocephalus and Chiari-II malformation. Diagnosis is prenatal via AFP, ultrasound and amniocentesis, or postnatal by exam and imaging. Management includes early surgical repair, VP shunts for hydrocephalus, orthopedic and urologic interventions, physiotherapy, and occasionally Chiari correction. In summary, the CNS develops from the ectoderm into the neural tube, while the neural crest and placodes form peripheral nervous system and sensory organs. The spinal cord shows key anatomical features, including the conus, filum, enlargements, and segmental nerves. Internal organization of gray and white matter, along with rex laminae, is critical for function. Vascular supply, including anterior and posterior spinal arteries and radicular arteries like the Adamkiewicz, is essential for cord perfusion. Next session.